Hello learners, I am Dr. Ushwinder Kaur from Swami Shraddhanand College, University of Delhi. Welcome to Swayam MOOC course on waste disposal, sanitation and its impact on health. So, first and foremost, we have to understand what is waste. Government of India defines waste as an unwanted and unusable substance or toxins that are discarded after primary use or worthless, defective or of no use. Any unwanted material or matter of any type after its utility is fully or maximally availed and useful substances or parts are consumed or removed after primary use. What is left is waste. Major types. When we try to understand and classify waste, there we need to understand what are the major sources of waste. So, first and the foremost source of waste is industrial waste. Most factories and industries produce various kinds of waste of either solid form of residue, liquid in form of residue, wastewater which could be contaminated with hazardous minerals and metals, or they generate air pollution in form of smoke or noise pollution in form of very high beeping noise from these industrial areas. The waste is disposed either in landfills or untreated materials are disposed in rivers and seas, which causes pollutions of various kinds. The second type of pollution is commercial pollution. The waste from schools and colleges, malls and offices are in form of plastic, paper, electronic waste, etc., and are decomposed either in form of waste or they are sold in form of scrap to the scrap dealer, which is a good practice rather than dumping it in the open space. Like for example, in the picture you can see of Pacific Mall where they have dumped all the mannequins along with the wood and other plastic materials on the passages outside the mall. So this is a very bad practice of just dumping it in the neighborhood of the commercial establishment. The third type of waste generated is domestic. Various household activities generate waste. Some biodegradable waste like fruits and vegetable peels and waste dead leaves and plants and are degradable in nature. Whereas non-biodegradable waste also produced in the household in form of plastic, whether they are bags or disposable utensils which are when we buy from food from outside, waste generated while cooking, cleaning, washing clothes and human excreta. So, when we are using various kind of chemicals for washing our clothes or cleaning our utensils and household, we are generating chemical waste, and of course human excreta which is very rich in pathogens are also without being treated sometimes being exposed to the landfill sites or the sewage lines. The fourth type of waste is from agricultural sources. Waste generated in agricultural fields are in form of crop residues, weeds, cattle waste, husk and sometimes disposed by burning, which causes air pollution. And as being in Delhi NCR region, we witness smog during the winter season because of burning of rice husk in the months of October and November. Many rural areas witness open defecation, which is very prevalent in India even today, and they of course create pathogen rich soil on the ground surfaces. People uses bushes, canals, forest ditches, fields for defecating their excreta. Even urban areas, defecation takes place in on railway tracks, open fields and grounds, especially people who are living in slums and squatter settlements which don't have any availability of some toilet facilities. Issues and problems of waste disposal. So, what are the issues? Now we have understood the four sources of waste generation, major sources of waste generation. Now we try to understand what are the problems which are caused by increasing amounts of waste. Rising waste generation caused due to economic growth, urbanization, industrialization and consumerism, including consumption patterns which causes environmental, health and social challenges. And very unprofessional management of waste at source with poor segregation lead to improper waste disposal, especially like e-waste and hazardous waste from the medical field, hospitals and nursing homes. Waste management facilities need to be developed with the latest technology, know-how and resources, financial aid, skills, competencies and decentralization, which in most cases is lacking. Poor waste management and disposal leads to environmental burdens like pollution, contributing to climate change and increase in concentration of greenhouse gases. Social economic negative impacts in form of diseases, poor health, fire, animals, health who scavenge on the garbage by eating the plastic and other harmful materials from the garbage sites. They get very sick, there could be explosions, flooding or landslides. Economic loss is also there as country or city or a region with heaps of garbage in landfills is a deterrent for tourism and losing of valuable resources as unsorted waste which could be reused, recycled as most waste segregation is done by unconsolidated informal sector. Improper solid waste management leads to stagnating water pools at dump sites, in canals and in waterways that acts as a breeding ground for insects, mosquitoes and cause vector-borne diseases. Health hazards for residents living close to these dumping sites with insects, flies, scavenging animals, bad odor. Water bodies get contaminated as runoff from dumping sites can pollute the water body. Emissions of greenhouse gases as many times these dump sites caught fire because of negligence of workers who are working at these dumping sites. Decomposing waste also releases harmful gases. There is also groundwater contamination through seepage of pollutants into the groundwater sources. Human health and negative impacts of improper solid waste management and disposal creates lot of issues. According to Swachhata Sandesh newsletter released by Ministry of Housing and Urban Affairs 2020, 1,47,613 metric tons of solid waste is generated per day from 84,475 wards across India. This gigantic number puts huge stress on collection, transportation and disposal of municipal waste, and improper management of waste possesses great risks to public health. An estimated 70 to 80% of waste collected in India is disposed in landfills improperly and unhygienically without taking any precautions. Neither the garbage collector has any gloves or mask or any proper clothing, nor he or she is aware about the needs to be taking precautions while handling waste. Most waste is decomposed in open drains or on streets. Water consumed from polluted water bodies leads to diseases like diarrhea, cholera, dysentery. Landfill should be least preferred methods of solid waste disposal as landfill sites release toxic gases in form of methane, carbon dioxide, hydrogen sulfide and these gases cause respiratory problem among people. Improper waste disposal also has an impact on health of animals and aquatic life. There is also seen some diseases and genetic abnormalities among them, also threatening aquatic balance. These sites are breeding grounds for invasive worst species like brown rat, house mice and wild boar and pigs because of abundant food available from these garbage sites, causing diseases like plague. Medical waste Indian hospitals generate and need to process about 4,20,561 kg of biomedical waste every day. Only 2,40,682 is processed. So, almost half of it is processed and rest is untreated and just dumped. There are about 37 common medical waste treatment facilities in India, but they are not able to handle the huge amounts which are generated, and they are also looking to decentralize the burden by having public-private partnership to reduce the load. Now we try to understand what is the concept of sanitation. Sanitation is more important than political independence, said by Mahatma Gandhi ji. India is significantly improving in water sanitation and hygiene, which is a program by UNICEF called as WASH. India has 7,935 towns, including 3,894 census towns, which are often not counted in measurements of urban services. Many peri-urban areas are emerging out of once rural areas, creating pressure on governance systems and public services. Moreover, about a quarter of urban population lives in slums. People who are often not counted or undercounted in estimating to reach to the basic services such as housing, water, sanitation and sewerage. Inadequate water supply and sanitation services in cities lead to overcharging, exploitation of the poor. The urban poor ends up paying more than the rich per unit water because of their inability of getting the supply connections. Secondly, the labor and time required to collect water from distant places. Thirdly, because water is sold at a higher rates by private and informal vendors. So we can see that this is the distribution of availability of toilet facility among different households at different levels of urban and rural population. Majority of urban households have closed drain system, whereas the drainage system of closed drainage is around 45%, whereas open drainage is about 37%, and there are households which are having no drainage is about 18%. Over 11 crore toilets and 2,23,000 community sanitary complexes built across in all states and union territories under Swachh Bharat Mission Gramin. Estimated number of rag pickers which or the waste collectors in a few cities of India like Mumbai, which has got 1 lakh rag pickers, Delhi which has around 75 rag pickers, Calcutta 40,000, Ahmedabad 30,000, Chennai 30,000, Bangalore 25,000, Jaipur 10,000, and they are possibly living in health hazard zones where their mortalities are high because of diseases they procure while working in with the garbage. They witness injuries, intestinal respiratory infections, eye infection, lower back pain, malnutrition, skin disorders and exposure to hazardous waste. Water supply for drinking and washing and sanitation facilities are usually very poor at the dump sites. Few government initiatives have been taken in order to improve the water disposal, sanitation and healthcare facilities. National Health Mission in 2005, Swachh Bharat Mission in 2014, Indradhanush in 2015 for rapidly increasing the immunization coverage among children. National Health Policy of 2017, Swachh Bharat Phase 2 launched in 2020 after 110 million households were provided with access to toilets during the first phase. Focus on the entire supply chain relating to providing waste management from fissile sludge to solid waste such as plastics. The government of India has also prioritized Jal Jeevan Mission implementation aiming to provide universal access to household by providing tap connection in rural India. India has experienced a revolution in toilet building. Before Prime Minister Narendra Modi came to power, just 40% of the country's population had access to household toilets, a situation to be vowed to change by the investing billions of dollars. He launched the Swachh Bharat Abhiyan or Clean India campaign on October 2, 2014 with the goal of eliminating open defecation and manual scavenging. Within 5 years, Swachh Bharat Abhiyan, the biggest cleanliness initiative, somehow missed out the India's 9.6 dry latrines and flush waste in the open. It has 4 years of India's biggest cleanliness initiative, but there are issues in the technology and the manual scavenging has not tapped into it at all. Swachh Bharat Abhiyan has taken into account India's 9.6 million dry latrines which flush waste in open on priority and how it should be cleaned effectively. In early 2020, Prime Minister Modi announced a crowd in Ahmedabad that India is now free of open defecation with 110 toilets built in 5 years and 600 million people gaining access to them. This infographic uses data from Ministry of Drinking Water and Sanitation to show how India's toilet coverage has climbed to 100% since the launch of the project. The Indian Prime Minister got the prestigious global Goalkeeper Award for Swachh Bharat Abhiyan. The Department of Drinking Water and Sanitation has been carrying out surveys through independent agencies to seek feedback on sanitation status across India. Recently, Swachh Sarvekshan Gramin to covered 17,559 villages in 709 districts in 33 states and union territories across India. Around 1,75,521 households were interviewed in this 17,559 villages based on the survey, and 95.4 are having toilet, have been using it regularly. This information was given by Ministry of State of Jal Shakti Shri Prahlad Singh Patil in the written reply to the Lok Sabha on March 2023. Another major issue of sanitation is manual scavenging. India is a fast becoming very urbanized, and in near future it will be in the list of developed nations. But manual scavenging is means manually cleaning, carrying or handling human excreta in an insanitary latrine or an open drain or a sewer or a pit or a septic tank continues to exist. The tools they use are brooms, buckets, long bendable bamboo sticks and shovels. The practice were made illegal in 1993. It is estimated that there are 7 lakh manual scavengers still existing in India. The deaths due to manual scavenging has been continuously increasing, and according to 2017, state of Tamil Nadu witnessed 140 deaths due to manual scavenging, Karnataka witnessed 59 deaths, Uttar Pradesh witnessed 52 deaths, and Delhi witnessed 12 deaths. In total, India, there were 300 deaths in the year 2017 because of manual scavenging. Work is in very unhealthy locations, and common cause of death are due to inhaling poisonous gases in the sewer tunnels, largely carbon monoxide poisoning. Other severe diseases are respiratory tract infections, nausea, diarrhea and tuberculosis, and sometimes hepatitis A. Landfills and their health implication in India. In India, material consumption has risen sixfold from 1970 to 2015 and is projected to double by 2030. Around 45% of municipal solid waste comprises of food waste and biodegradable waste. Government data shows significant improvement in dump waste processing, rising from 18% in 2014 to 68% in 2021. Critical key interventions such as composting, biomethanization and waste of energy are being prompted to address municipal wet waste. Dry waste, accounting for approximately 35% of the total waste, is a significant concern. Plastic waste generation at the rate of 2,600 tons per day poses a significant challenge in the waste management. Plastic waste generation in India is predicted to increase more than threefold from current levels, making us the fifth largest contributor of marine litter by 2025. Collection and transportation are the main expenses in solid waste management. Plastic waste disposal causes of soil pollution which harms soil fertility and poses risks to food security and human health. Many discarded plastic ends up in landfills, reacting with the toxic substances into the soil. According to the government statistics, 15,342 tons of plastic waste is generated every year. Out of this, 6,000 tons of waste remains uncollected and littered. As plastic is non-biodegradable, it stays in the systems and destroys the whole planet. The harmful chemicals contaminate the health of ocean creatures and then by entering into the food chain posing a danger to human health. Currently, total disease burden on India due to unsafe water, sanitation and waste management is 4.6%, and this can come down drastically if India becomes 100% Swachh, which means a country where there is no cases of open defecation, or a country with that segregates its own waste, and a country that knows how to effectively manage the waste which is created. Best practice models can be seen. Today, Kerala is known as a state which is free from the practice of open defecation and is moving towards the target of becoming 100% waste free state. Kerala has many leading examples when it comes to effective waste management system. For example, Kannur is a plastic free city. Alappuzha is a city that manages its own waste without a landfill. Thiruvananthapuram has become a waste free zone. The examples I am talking about have succeeded after doing through environmental havoc. Alappuzha in Kerala, it is also known famous for its backwater, is today known for managing their waste without a landfill. But few years back, the city segregates percent of its waste in 12 of its city's 23 wards. More than 80% of households have biogas plants and pipe composting system. This was not the situation earlier, and there was no garbage collection system in the city. People used to dump their garbage in 6-hectare plot it owned in the Saravabodhyapuram, a village in the neighboring Marakulam village panchayat. This had led to environmental crisis, contamination of water sources, stench, and cases of chikungunya, malaria and other diseases were on rise. That was when Thomas, who is now the Minister of Finance in Kerala State Assembly, thought of changing the situation, and he decided to make a ward waste free and showed how diseases and health parameters can be improved just by managing the waste effectively. Center for Environment has been working in Muzaffarpur in Bihar for past 2 years. The city is commonly known as Macharpur because there is high number of dengue, malaria and chikungunya cases. But for the past 2 years, the situation is changing and lot less cases of deadly diseases have been reported because the city is moving towards decentralized waste management system. Local efforts appear more positive than countrywide assessments. While the situation may look dire for a nationwide perspective, local governments are often finding more successful. Hyderabad has declared the city free from open defecation, and this is followed by a series of efforts by Greater Hyderabad Municipal Corporation to boast access to sanitation in the Telangana state capital. The measures included built up of 1975 private toilets, 384 communal toilets with more are underway. Health consequences: contaminated water and lack of sanitation leads to transmission of pathogens through feces and to the lesser extent through urine. Now, diseases which are transmitted by fecal pathways include diarrhea, disease, enteric infection, hepatitis A, trachoma and adenovirus, that is causing conjunctivitis. Most of these diseases are transmitted through fecal oral pathways, but some are transmitted through fecal skin pathways, for example, skin related disorders, and there could be some which are passed through the eye pathways. These transmissions occur between human as well as between animals and humans. Pathogens carry through urine results into animal to human transmissions. Poor personal hygiene causes fungal skin infections such as ringworm and scabies. Lack of hand washing is associated with respiratory infections. Inadequate hand hygiene during the childbirth is linked to infection and neonatal mortality. Now let's look at some solutions how we can reduce this waste issue and sanitation issues. First is prevention, avoiding or generating and creating less waste at the foremost. Second, reuse, use products without changing their form and quality like clothes and shoes. Recycling waste, processing the waste products materials into useful new products or raw material. It helps to optimize the use of resources. Recycling helps in reducing the land, water and air pollution. Items which can be recycled are paper, plastic, glass, biodegradable waste into compost or vermicompost. Ash produced by coal burning can also be used for making ash bricks and slabs. Recycling helps in protecting the environment and also assists in reduction in soil, air and water pollution. Recovery, extracting or generating energy or materials from waste that cannot be reused or recycled for generation of biogas from waste. Waste disposal, last option is getting rid of the waste which cannot be reused, recycled or recovered are dumped into the landfill sites or dumping yards. Waste disposal is a system or a process or a mechanism of getting rid of unwanted material by burying, burning or dumping it on the land and dropping it in the sea. This should be the least preferred option as it has major environmental repercussions and negative impacts on human health and quality of life. Some conclusions and solutions for waste management. The first and the foremost is segregation, sanitation and clean environment, fluid safe drinking water, collection, transportation, storage and treatment. Awareness generation on hand washing with soap. Awareness campaigns can be extended to schools and Anganwadis as an excellent opportunity for children to develop the habit of washing hands. Awareness generation on hygiene practice. Adolescent girls can be empowered through improved menstrual hygiene management. Food hygiene practices need to be disseminated strategically for having a healthy family. Sanitation for health. The link water hygiene practices should be extended to each and every person in society as waterborne diseases are very common which affect human health. Awareness generation and capacity building, training, camps, rural volunteers, participatory approach, staff conducting outreach activities need to be oriented for active communication with villagers on water and sanitation services. Capacity building for such people should be done for proper knowledge and effective communication. Scientific and non-colored socially and culturally knowledge needs to be conveyed through sanitation messages and process linking with health. Community collective consciousness for managing liquid and solid waste. Non-governmental organizations plays an important role. The dream of open defecation free India cannot be achieved by government efforts only. Non-government organizations need to play an active role in this. Awareness training, medical camps, regular contact with the field staff, dissemination of information in simple pictorial formats can improve the situation of great extent. Horticulture units need to be replicated as it is a milestone action for sustainable development. Water filters can be used to have safe drinking water. People needs to replicate the model. Proper management of municipal and solid waste should have minimum effects on environment and health impacts. The significance of environment and health impact assessment. Attention should be paid to storage, collection, transport and intermediate transfer of bulk, transport and final disposal of waste. Now let's get into some insight of pictorial distribution of various kinds of dump sites. You can look here that there is a huge dump site at Bhalsava, which is one of the second largest landfill in Delhi. We can also see a dumped garbage area. Along with that, there are water tankers standing adjacent to it. So you can just imagine the type of contamination which is occurring because of the dump site, and a water which is a drinkable water which will be supplied to somebody will be infected by some kind of pathogens because of being in the waste in a contaminated area. Secondly, we can see there is a place of collection of garbage, but all the garbage is outside that place and that garbage is being scavenged by cows. And then we can understand that these cows are not only eating what is edible but also eating non-edible items like plastics, maybe paper, maybe some other issues. So we have to see that how we can manage this garbage which is lying outside and creating flies, mosquitoes and other pathogens. In this next photo, we can see that sewage leakage is there, and on the road there is a blackish water which is the sewage outflow which is occurring during the rainy season, and of course it is full of filth, smell, odor, and of course it is creating lot of damage to the neighboring people. People who are living there will be witnessing some kind of disease, diarrhea and water related issues. In the next picture you can see construction waste which is lying there, which could be used to increase the height of low lying area, but it is dumped on the main outer ring road of Delhi, and it is of course not only scenically bad, it is creating a nuisance for the traffic. And the next photo is basically showing the green waste which is dumped with the construction waste, which is basically showing that this could have been a compost bin and a manure could have been made out of this, which is being just dumped and creating foul smell when the plants will decay. Now, how we can recycle the waste at home? We can collect our vegetable waste and put it in a bin and try to make a manure, and from that manure we can have a beautiful house grown crop. You don't need a field, but you can use the pot to grow your vegetables. The next photo is showing a bottle which can be used to put in the small plastics which we just dump it in the dustbin and protect it from being getting into the body of fishes or other animals. Thank you very much. I hope you are able to understand the difference between waste, the different types of waste which are degradable and non-degradable, how the medical waste could be infectious and non-infectious, and how we can reduce the impacts of waste to our society, to our neighborhood, and live a more cleaner and a healthier life. Thank you very much.